Hi, please do take a seat. So, how are you today? Fantastic. I'm good too, thank you. Amazing. So, I believe you have requested an evaluation of your teeth to see if you are suitable for orthodontic treatment. Is that correct? Amazing. So, as you emailed in, I'm sure you saw on the website the process. Yeah, it's very, very straightforward. So we'll just start off by taking a scan of your dental arches. So that's your upper jaw, maxilla, and lower jaw mandible. These are non-ionising scans, so that means there's no radiation risk. However, we will need to do some x-rays just to ensure that the roots are okay, and that will be ionising, of course, because that is an x-ray. Is that okay? Okay, perfect. Yes, it's nothing to be worried about. Of course, it's just something I need to outline at the beginning just to ensure everything's okay. Yeah. So we'll start off by doing this initial scan, and then I'll input the data into the computer. It will take around 2 to 3 minutes for the data to process, and then we'll have a real data scan of your arches, and you'll be able to see in a 3D render your teeth and then what they will look like before, during, and then after orthodontic treatment, so you can get a visual representation of what your teeth will look like. Okay? Yes, so you can see it today, and then you can make a decision if you want to move forwards with the treatment. We'll also discuss the types of treatment, because there are 2 standard types of treatment that we recommend when it comes to aligning teeth. Okay? Yeah. Perfect. Fantastic. So what we'll do is, if you just pop back there, and if you could just insert this here into your left cheek, and then here. Amazing. Okay. Perfect. Right. So if you could just make sure your mouth is as open, as wide as possible, I'll just get the scanner here. Amazing. So that's it. That's all done. I'll just input that data now into the computer, okay? Right. So while that's processing, we'll just do a quick x-ray, okay? Yes. So if you could just turn to the left. Thank you. And turn to the right. Thank you. And now just face forwards again. Right. I'll just double check everything's okay there. Yeah, it appears your roots are healthy, which is good. We just need to check that every time we start orthodontic treatment, because the roots are what hold your teeth into position, and some people have shorter roots and they're not aware of that, and they go through with orthodontic treatment, and that can lead to some teeth falling out. But don't want to worry you, because your roots are perfect, and we will monitor you throughout the treatment to ensure that nothing goes astray. Yes, and your last dental checkup, everything was fine, wasn't it? Yeah. Yeah, perfect. Yes, I can tell that you take good care of your teeth. Yeah. So what I'll do is I'll run you through the couple of options that we recommend as standard treatment, and then your imaging will be processed and we can have a look at the before and afters, okay? Amazing. So, the first line of treatment would be traditional braces. So, you're probably aware of traditional braces. They're quite common. Yeah. Yes, correct. Those are the metal braces that are fixed onto your teeth with bonding. Yeah. So what would happen is you would come in, we would set the braces on with bonding, and then you would come into the office every month or so, and we would tighten and change the alignment of the brace, which would then straighten your teeth. Yes, so really, other than maintaining great dental hygiene using flossing, that It could be water flossing, intradental pecks, or normal floss. And of course, brushing your teeth twice daily, especially after meals. Yeah, that is the bare bones of what you would have to do. And then we do the rest, really. You come in, we tighten things, we track things. Yeah. Yeah. Now, the main negative, if you want to call it a negative, to traditional braces is the fact that they, of course, are quite obvious. That's why most people are aware of that form of treatment, because they are quite visual. They are very much there. Yeah. Which is why sometimes people opt for what we like to call clear aligners. Now, have you heard of clear aligners before? You have? Yes, there's some brands such as Invisalign which are more of a well-known name. There's also ClearCorrect. Yeah, well, the clear aligner treatment that we offer here at the clinic is CE marked and recommended by the dental associations. Yes. So with clear aligners, you can kind of tell in the name, they're clear, they're quite cosmetically invisible, some could say. Most people don't recognise when someone's wearing clear aligners. That is the main benefit of clear aligners. Yeah, they have that invisible quality that people opt for. From time to time, if they have a special event coming up and they don't want to be wearing braces, because obviously traditional braces are associated with teenagers, and yes, if you're wanting to maintain a sophisticated profile, it can be an option. They are slightly more costly, though, I must, warn you. There's about 1,000 difference, yeah. But it all comes down to preference. Now, I must say, with clear aligners, there is a little bit more upkeep. You have to take a little bit of ownership throughout the process, because you are required to ensure that you are changing the clear aligners when necessary. So with clear aligners, you get anywhere from 15 to sometimes 60 different sets, and these move your teeth gradually, so they're all shaped slightly differently. And I always recommend a 10-day change approach, which allows the teeth to shift and set in place without damaging or shifting the roots in any way we wouldn't want to. Yeah. And something I should also mention, you have to wear them 22 hours a day, which leaves you 2 hours to snack, basically. Yes, which doesn't seem like a big window, but you can space out your meals, or if you're practicing fasting or anything like that, it can be a little bit more easier, or depends on your lifestyle, really. So that's something you'd have to take into consideration. Good question. Yes, you have to make sure you brush your teeth every time you've eaten, because if you put the clear aligners on and your teeth are not clean, that can lock in plaque, causing bacteria and break down the tooth's enamel, which is not good. Yeah. Right, well, I'll let you have a little think about that, but in the meantime, we will have a look at your visual representation. It's just processed. I'll get it up on screen here. Right, so as you can see, this is your alignment of your arches at the moment. Yeah, good question. So this is what we like to call a class 3 edge-to-edge bite. The anterior teeth are biting directly on top of each other, as you can see. Yeah. Unfortunately, this is quite destructive to the teeth. We want to ensure that the teeth, particularly the front 2 teeth, overjet by a millimetre and overbite by a millimetre as well. That way they are biting in a healthy way, not causing any chipping. Yes. I can't see any chipping on your teeth now, but if you give it 10, 20 years, I can guarantee you, unfortunately, there will be some signs. Yeah. I've seen it so many times before, so it's not just a cosmetic thing. It is required if you want to maintain the integrity of your teeth. Yeah. So this visualization will show you stage by stage what your teeth will look like during the process. So okay, let's move throughout. So as you can see, gradually your teeth begin to straighten. Your front teeth will move forward slightly and your lower teeth will shift backwards. Yes, and this will create a healthy relationship between your upper and lower incisors. Yeah. Right then, have you had any further thoughts then on which form of treatment you would personally prefer to go with? The clear aligners that seem more appropriate? Okay. What I'll do is I actually have a set of clear aligners here that I can show you. So these are our dummy aligners. And I like to just showcase these to our patients just so you can get the feel and the look of what they will be like. So of course these are not moulded to your teeth, and it will take approximately 2 weeks before we have your first set ready, because there is a process of course of developing them in the lab which requires astute medical oversight. So yeah, have a look. Yeah, yeah. So these at the beginning can be quite painful. I just want to lay that out on the table, as can traditional braces, because of course we are shifting and moving the teeth, so you will expect to feel a pressure in your mouth and some slight pain. It shouldn't be any more than 6 or 7 out of 10. If it is more painful than that, then please do make emergency contact with us, because we want to ensure that nothing is going wrong. But it's very, very unlikely that you'll encounter any issues with either treatment. So yeah, we have a 99% satisfaction rating with both forms of treatment, and you can check out our reviews on Google. Yes, yeah. So rest assured, we want to ensure that your treatment is as seamless as possible. Yeah. Good question, good question. So as you can see, there were 15 stages there. So that is 15 sets of clear aligners to get that result. One thing to look out for with clear aligners is something we like to call tracking. So we want to ensure that the aligners are fitting snugly on your teeth. So if you start to see any gaps or spaces appearing, then please do send photos through via email to myself, and I will have a look at them. And sometimes there is a case for us doing a rescan just to ensure everything's tracking properly, and doing potentially some mid-treatment work where we slightly change the predictions, because obviously software is not 100% accurate, it's 99% accurate, but sometimes there are cases where we do need to do treatment midway through. Yeah, additional treatment, which does come at a slightly higher cost of an additional 500 if that does happen. And that is all documented in the contract that I'm going to have you sign if you are wanting to progress. I just wanted to let you know and be fully transparent that that's something that can happen. It's very rare, but it can happen. Yeah. Okay then, have you got any further questions? Yeah, so if you do run into any tracking issues, the first line of defense is to use something that we like to call Chewies. Now, Chewies are little devices, they're made out of rubber, and you simply bite onto them, and that just helps the clear aligner sit more seamlessly against your upper and lower dental arches. Yeah. All very straightforward. And what we'll do is we will email you a video guide to best practice on how to clean and maintain your clear aligners, as well as using the Chewies. Yeah. There are some cleaning devices on the market that we recommend. We do sell some as well, and I'll write a note here to the receptionist to guide you through the options that we have. Now, you don't have to purchase one today, and you can do some research yourself, but we do recommend you at least looking into getting an ultrasonic cleaner and detergent tablets for clear aligners. Yes. So an ultrasonic cleanser just helps once a day to ensure that the clear aligners are not getting any buildup in them. I also recommend you also brushing manually with your toothbrush. Do you use an electric or manual toothbrush, by the way? Manual. Okay, that's fine. Yeah, so just making sure you scrub in and amongst all the grooves. That will ensure that your aligners are healthy and happy, as well as your teeth. Fantastic. Yes. Okay, then, if that's the choice you want to go for, then I'll just print out this contract. Now, if you could just sign here for me. And just here. Thank you. And once more here. Fantastic. Now, that's your copy. If you could just do the same here. Fantastic. Thank you so much. So I'll keep that one, you keep that one. That's just a record of our agreement, and we look forward to, look forward to it. So, yes, so payment, of course, as advertised on our website, is taken in 2 installments. So you'll pay for half of the treatment today at reception, and then you'll pay for half of the treatment once completed. Just makes things easier for our patients. Yeah. And if you do have any further questions about treatment, then please do just drop me an email and I'll reply to it within 24 hours. Yes, and there are a few support groups online that, yes, you've come across some on Reddit. Perfect, yes. And there is the Invisalign subreddit. People share their experiences there. But if you're looking solely for advice, I would recommend you contact us. Don't take any medical advice from the forums, but it is a good place to look for support during your treatment if you're experiencing pain and such. Amazing. Well, it was great to see you today, and we certainly look forward to getting your smile 100%. Lovely. You have a nice journey home. See you. Bye.